I'm Balaji Nujella, physiotherapist from Gallant Clinics, Miapur. Today's our topic is regarding one of the most common issues nowadays which we are facing, whether it is young adults or elderly people or even sometimes even in the children. Basically it is knee pain. Coming to knee pain, first and the foremost thing what we need to remember is knee pain doesn't happen just because of only osteoarthritis or degenerative joint disease. There are n number of reasons for your knee pain, and these knee pains have to be properly identified, properly assessed by either a seasoned physiotherapist or an experienced orthopedician. What I request with all these social platform and all these things, what I request my viewers is not to unnecessarily just Google out and just come to your own conclusions. The very idea of making this program is to educate you people regarding your knee joint issues. Especially today's topic is osteoarthritis knee, which is one of the most common as well as the happening issue nowadays with all the individuals. Coming to osteoarthritis knee or knee joint pain because of degenerative joint disease, it's basically a disease, or more than disease, what I would like to say is always it's a disorder wherein your joint space is badly reduced to the maximum extent, and usually it starts from mild reduction of joint space, or mild reduction of joint space to moderate osteophyte formation, or that crackling sounds or the crackling thing what you happen to experience in your joint. Then coming to severe pain or severe crackling sounds, night pains or night cries, and even sometimes even leading to certain deformities of your knee joint. So in a broad based classification, what we usually do is we follow a system called as Kellgren-Lawrence grading of classification of OA knee or osteoarthritis knee. Basically to say, for general public regarding osteoarthritis, what are the common signs? First we will talk about the common signs today. The first common sign happens something like this: a pain in the knee joint, usually early in the morning, with a mild joint stiffness in the early morning, soon after you get up from the bed. And this stiffness usually disappears by movement, or sometimes even within 5 to 10 minutes as soon as you get up from the bed. And this is classical regarding your knee osteoarthritis, otherwise what we call it as degenerative joint disease. The very word says that it is degeneration, that is wearing and tearing of, in fact to say wearing out of the joint or the joint structures. And because of this wear out and worn out joints and all, you will be feeling some amount of stiffness in the joint because of surrounding soft tissue spasm, tightness, and synovial membrane stiffness and all those things. Excessive fluid accumulation overnight in the joint. All these things are common in knee joint pains, especially in osteoarthritis knee. But there is one question which people or patients do often ask me: sir, how do we differentiate between an osteoarthritis and a rheumatoid arthritis? Let me be very plain. A classical presentation between osteo and rheumatoid arthritis is simple. Osteoarthritis, early morning pain is there. Early morning joint stiffness could also be there. Most commonly early morning joint stiffness. But the stiffness disappears just like that within 5 minutes or 10 minutes from the time you wake up from your bed, or by doing some good amount of warm-up movements or something like that. But whereas in rheumatoid arthritis, which is another type of arthritis wherein your immune system is morely involved and all, your stiffness, early morning stiffness and the joint stiffness will progress up to, or will persist up to 45 minutes to 1 hour even after you got up from the bed. So the persistent joint stiffness which is not coming down immediately, roughly for a time frame of around 45 minutes to 1 hour even after once you get up off the bed, could be. You need to just don't come to a conclusion with this simple program that yes, you have some joint stiffness or you have rheumatoid arthritis. Those are certain signs of rheumatoid problems. So For the conclusion and all, for the diagnosis and all, do not self-diagnose yourselves. Meet your concerned orthopedician or a physio, an expert physio beside near to your place, and get it diagnosed by a professional only. Now, coming to rheumatoid arthritis, another different or another big important change or the difference between rheumatoid and osteo is osteoarthritis usually happens in larger joints or major joints, and especially the weight bearing joints in the body, whereas rheumatoid arthritis usually affects the small joints of the body, that is the joints in your hand or the joints in your feet. These are the small joints, and also usually the rheumatoid arthritis happens bilaterally, means on both sides, and symmetrically, nearly the same joints on either sides. So, but again, once again, what I say is it could be sometimes because of certain trauma also you will be having bilateral involvement of the joint pain and all. Do not conclude yourselves. Once again, I am telling. Now, coming to today's first thing is, the first important thing is, do you need surgery for knee joint pain? Now, coming to knee joint pain, as I have already reiterated, there are grades. We call it as Kellgren-Lawrence grading, in which grade 0 is absolutely normal. Grade 1, there could be a doubtful decrease in the joint space and could be or no osteophyte or any extra bone formation. Grade 2, there is mild decrease in the joint space with possible osteophyte formation. Grade 3, progression of these things. Furthermore, decrement of joint space along with osteophyte formation, for sure osteophyte formation, and these osteophytes, this joint space could be considerably reduced. Grade 4, a very bad or total loss of joint space with the deformity in the joint and all these things. This grading can depend upon, don't worry about the grading and demarcation or classification or what we call it as the explanation about the grading. The explanation regarding the grading differs from author to other, but these are the 4 major grades: grade 1, 2, 3, 4. But these grades are dependent on your clinical presentation, that is pain, as well as these grades are dependent on the X-ray which is taken. Most of the times your orthopedician will be asking you to get an X-ray of the affected knee joint in standing position or in the weight bearing position, and after looking at the X-ray, the orthopedician might write down it is grade 1 or grade 2 or grade 3 or grade 4 arthritis. But most common thing or most common doubt people have is, sir, if it is grade 2 arthritis, don't we require surgery? If it is grade 3 or 4 arthritis, do we require surgery compulsory, or is surgery compulsory? The criterion for surgery is totally, or the decision for surgery is totally the onus decision of the orthopedic surgeon. No one else is authorized to comment upon it. But thing is, most of the times the surgery will be decided upon your clinical presentation. It is something like this: a very bad joint, but not so much of pain, but not so much of difficulty in your activities of daily living. So for sure you might not be a person for the surgery immediately. Totally lost joint space, bone to bone interface is there, bone to bone attacking, or bone to bone is directly, the thigh bone is directly landing on your shin bone, and the joint space has moderately or severely reduced, in fact severely reduced joint space and all. For sure your activities will be limited and you are prone to be dependent on painkillers. If the main major stake here is, if you are totally dependent on painkillers every day or every other alternate day or something like that, at least more than 3 to 4 times, more than twice to thrice a weekly, or more than 3 to 4 times weekly, for sure you might be advised by your orthopedician to go for a replacement surgery. This is what the thing is. But if you are able to perform your activities of daily living with some amount of ease and some amount of rest, modifying your daily activities, and still you are able to maintain your ADLs, maintain your pull up on your life and all, for sure the surgeon might wait. It is all the subjective and the surgeon's choice whether replacement surgery is required or not required. So there is no hard and fast rule that every osteoarthritis knee patient or every joint, the knee pain patient should undergo surgery, and there is no hard and fast rule that you should not undergo surgery. It is all clinically related. What are the clinical things? Again, I am reiterating: severe pain, night cry. Night cry is one of the important thing. Let's not discuss the clinical part behind this, but basically those symptoms like getting up in the bed or getting up from the bed in the night with severe pain in the knee joint, even at rest. Even at rest, you can have pain, especially during night, during sleep. That is called a night cry. If there is any severe night cries or severe episodes or too many episodes of night disturbance sleep, then hindrance of your activities of daily living, that is self-care, getting up from the bed, reaching your your own personal activities and all. Then if you are badly dependent on painkillers, either daily or at least more than 2 to 3 times weekly, if you are dependent or totally addicted to painkillers to get away from this knee pain, for sure you are on the list for surgery, depending on your fitness, depending on your cardiovascular fitness, surgical fitness and all. Your orthopedician is the main person or the person who will decide regarding your surgery. Whether to go for surgery or not is totally subjective and totally individual opinion. Thank you all.